you. Greetings, everyone. Welcome to the Medicaid and CHIP program, MACPro Quality Measures Reporting, MACPro Roles Training. My name is Jeanette James, and I am a part of the Centers of Medicaid and CHIP Services in the Data and Systems Group under the leadership of Jessica Kahn and Deborah Stewart. I also work in the Division of Operations and Technical Services under the leadership of Donna Kaufman. Our division assists the business components in developing and providing training and assistance to the MACPro user community. Today, our MACPro training will cover the quality measure reporting, MACPro training for CMS. I will now turn it over to Megan Thomas to provide an overview of today's training. Megan?
Great. Thank you so much, Jeanette. Good afternoon, everyone. My name is Megan Thomas. I'm a technical director in the Division of Quality and Health Outcomes in CMCS. So on behalf of CMCS, I want to welcome you to the Quality Measures Reporting MACPro Roles Training for States, and thank you for joining us today. So over the past few weeks, we've introduced MACPro as a new system that will allow states, territories, and CMS to process Medicaid and CHIP initiatives, including reporting on the CMS core quality measure set, for which MACPro will initially be released in December 2015. And this refers to child, adult, and health homes core set reporting, as well as reporting under the Maternal and Infant Health Initiative grant program. A very large team of individuals from across the center has been working really hard to develop a new system for some of you, and a new and improved system for others of you for reporting Medicaid and CHIP quality measures to CMS. Today's session will provide some general information about MACPro, but we'll focus primarily on the state user roles available in the system for quality measures reporting, as well as to help individuals determine which user role or roles to request. And I note that determining one's user role or roles is the critical step in gaining access to the system, and there will also be some action steps for many of you immediately following this training. We hope that you'll find today's session informative, and we look forward to introducing MACPro, and specifically the state user roles available for quality measures reporting in MACPro to you today. And with that, I'll turn things back over to you, Jeanette.
Thank you so much. We will now turn the mic over to Laura Holmquist, who has a technical announcement.
Hi everyone, I wanted to thank you for joining today. We did want to alert you that we just got word that WebEx may be doing an update right around the time of our presentation. So in the event that we do lose our feed, we will be sending out the slides to all attendees. So if you have not yet RSVP'd this session, if you just came into this, if you could do that as soon as possible, that would be wonderful. And then we'll have the list to send the slides out to. So with that, I'm going to pass over to Marshall Nannis, who is our presenter for today.
Hi, my name is Marshall Nannis, and I'm with Truven Health Analytics. Truven Health is the education, training, and assistance contractor for the MACPro system. The purpose of today's webinar is to help you understand the roles and the responsibilities of the roles in MACPro's quality measures reporting submission process. The call is on presentation mode to prevent any background noises. There will be an opportunity to ask questions at the end of the presentation, and CMS training personnel are here to assist with any questions you may have at that time. Please note that this session will be recorded. We have a full agenda for today. We'll start with a brief background on MACPro. Then we'll discuss the rollout plan for the MACPro quality measures reporting, followed by an explanation of the MACPro quality measures user roles and the process flows in which they're involved. The webinar will end with some information about how to get your MACPro role, next steps, how to obtain technical assistance for using the system, and an opportunity to ask questions. Now let's begin with a brief background on MACPro. MACPro is a web-based system for the submission, review, and management of Medicaid and CHIP initiatives, such as quality measurement reporting and state plan amendments. For some applications, MACPro will be a new online submission tool. For others, it will be a change from what was a manual workflow to an electronic workflow. And for some, it will be the first time information is collected. In terms of quality measurement reporting, MACPro replaces the CARTS reporting for adult core set reporting and Section 2A of the Child CARTS report. Additionally, Health Homes core set reporting will be reported for the first time using MACPro. MACPro is also the system for reporting under the Adult Medicaid Quality, Improving Maternal and Infant Health Outcomes in Medicaid and CHIP grant. MACPro is being implemented to improve the state reporting and federal review processes, program management, and transparency. Both CMS and states will know where a submission resides, when the CMS response is due, and the status of the review. Additionally, MACPro supports data-driven decision-making for Medicaid and CHIP programs. This diagram represents the concept of MACPro as a two-way communication tool. The stakeholders around the outer circle are submitting and/or obtaining MACPro information. Also, you'll notice there are two one-way arrows pointing outward at the bottom of the diagram. These represent the MACPro system feeding public information to healthcare.gov and Medicaid.gov. The result is greater transparency because these public resources will use a single source of truth about the Medicaid and CHIP program. Let's talk about Quality Measures Reporting Rollout Plan. The initial rollout of MACPro will occur in December 2015. As part of the rollout, webinar training sessions and written instructions are being offered on the roles available in MACPro, how to get access to MACPro, and how to submit and review a Quality Measures report. Today, we'll cover the first bullet and discuss the CMS and state roles available for Quality Measures reporting. Now, we'll review the different state user roles within MACPro for Quality Measures reporting. A number of distinct roles have been established for states within MACPro. These roles determine in what capacity a user will employ the system. It's important to note that user roles in MACPro differ from those that are used in CMS's other web-based systems like CARTS, MMDL, and WMS. And in some applications, this is the first time that there are roles. We'll discuss the Quality Measures roles and recommendations for who should hold each type of role during this presentation. This slide lists the 4 Quality Measures roles. A state user may have more than one role in MACPro, with the exception of the State System Administrator. With this release, individuals with a State System Administrator role can only hold that role. It is important to note that all state roles must be filled for proper workflow functionality. The state editor begins the process by creating a MACPro Quality Measures report. Individuals with this role can create Quality Measure Submission reports, browse, view, and edit Quality Measure Submission reports, delete not yet submitted reports, and generate data reports. State editors may concurrently hold the roles of State Point of Contact and State Director. The State Point of Contact, or SPOC, is responsible for reviewing a Quality Measures report created by the state editor prior to sending it to the State Director for final review, certification, and submission. Individuals with this role can browse, view, and edit Quality Measure Submission reports, respond to Seek More Information requests, delete reports that have not yet been submitted, uncertify reports, and generate data reports. SPOCs may concurrently hold the roles of State Editor and State Director. The State Director role is responsible for doing the final review on the Quality Measures report and then certifying and submitting the report to CMS. We do want to point out that the State Director role does not need to be filled by the Medicaid Director of a state. Individuals with this role can browse and view Quality Measure Submission reports, certify and submit Quality Measure Submission reports to CMS, and generate data reports. State Directors may concurrently hold the roles of State Editor and State Point of Contact. The State System Administrator is an administrative role that can approve state user roles, modify state user profiles, reassign state user tasks, disassociate state users, and generate data reports. For this release, the State System Administrators may not hold any other roles. Please note that the process to obtain IDs will change over time. For this initial release, State System Administrators will not have to approve all initial role requests, only additional role requests from existing users. Additionally, there may be activities on this list that the state admin may not be able to do initially, but will further down the road. This diagram outlines the full submission process from the state editor's creation to the completion of the CMS review. Let's take a look specifically at the state process. Here is the full MACPro State Quality Measures Reporting Submission workflow. Let's walk through the steps for the certification process. The state editor begins by logging into MACPro and entering information to create the quality measures report. When completed, the state point of contact receives an email notice that a report is ready for review. The SPOC logs into MACPro and reviews and edits the report and sends it to the state director for certification. The state director receives an email notice that the report is ready for certification. The state director logs into MACPro and reviews the report and can select to either deny the report or certify it. If certify is chosen, CMS receives an email notice that the report is ready for review. Let's talk about how to get your MACPro rolls. For this initial release, you will need to fill out a form to request an ID, and you will be sent a username and password. This week, you received an Excel-based MACPro roles template. You will need to meet with your program in your state, decide who should hold which role or roles, and fill out this form. We need to stress that all roles will need to be filled for a state program to submit a quality measures report. You can hold more than one role, but someone must be assigned to each of the 4 roles. Once you fill out the template, a representative from each program will send one template with all of the usernames in it to the MACPro help desk at the address listed on this slide by November 19th. If you have any questions while filling out the template, please contact the help desk for assistance. Here's a snapshot of what the state roles template looks like. The information needed in the spreadsheet includes name, contact information, state, manager name and department, a yes/no response to the authority or type of quality measure you'll be reporting, such as adult, child, health homes, or MIH, and a yes or no response to the roles you'd like to request. Again, we want to stress that all information must be filled out for the role requests to be processed, and all roles must be assigned in a state's program to submit a report. Now let's talk about next steps. The main next step is to complete the roles template and send it to the MACPro help desk by November 19th. Watch your email for more training sessions and material. We'll be hosting additional sessions in the next few weeks, including in-system demos. Written material will also be provided on how to submit reports, among other topics. Technical assistance will be available to MACPro users. We expect users to have questions as the MACPro system starts being used, especially for issues with login information, passwords, accessing MACPro, and viewing quality measures reports. Although there will be trainings and reference materials available to walk you through the quality measures reporting, submission, and review processes, there are also 2 help desks. One to provide assistance on the MACPro system, and a second to help with quality measure content. To help expedite an answer to your request, here's the information that should be provided in an email request to the help desk. Your contact information, the application you're using, such as adult core set reporting, child core set reporting, health homes core set reporting, etc. Give a detailed description of the problem, including how many people are being affected by it. Specify the last screen or activity that was performed before experiencing the issue, and include the error message that appeared, and preferably a screenshot. We'll now ask the operator to open up the phone lines and give the instructions to ask questions.
Ladies and gentlemen, if you would like to ask an audio question, press star 1 on your phone and then immediately record your name. Your first question comes from the line of
Jesse Springer, Wyoming.
Please proceed.
Hello, is it correct that Kid Care CHIP or CHIP programs will they remain on carts and only Medicaid programs will be reporting in MACPro?
This is Megan. I can tackle that question. So, Jesse, if you are referring to child core set reporting for CHIP programs, that will also be in MACPro. But as you likely know, there are other portions of the CARTS report, and that is remaining for now in the CARTS system. But child core set reporting, those measures can be reported for Medicaid programs, for CHIP programs, or for Medicaid and CHIP combined. those will all be in MACPro.
Okay, thank you.
Thank you.
Your next question comes from the line of.
Anton, State of Nebraska.
Please proceed.
So my question is, I was not able to actually sign into the webinar, and during the beginning you had said to, or if we were disconnected, you would send us the slides, and I'm wondering if you could send them regardless.
Hi there, this is Laurel. We will definitely be sending the slides out after the session.
Okay, great. Thank you.
There are no additional questions at this time.
Oh, actually, hi, this is Marisa. I have a question. The user who was just speaking, what was your name again? Because you didn't sign into the webinar. We want to make sure we have your name and contact information to send you the information. Hello?
The person has already been removed from the question.
Oh.
Why don't we advise the person to send an email to the MACPro help desk, and they will have their contact information that way, or they can submit a question through the chat, or their contact information through the chat.
Thanks, Megan.
Latasha, would it be possible for us to open up the phone line since we have a few minutes left, just to, in case if there are any final questions?
Yes, one moment. I do show that there is a question, and then I'll open the lines while that person answers the question.
Oh, how about this? Once the questions slow down in your queue, could we open it up at the very end?
Oh, yes, that's fine.
Oh, wonderful. Thank you.
And the next question comes from
Anna Buckner, Montana.
Please proceed.
Hi, yeah, I was curious. So if we have different people that are doing the adult quality measure reporting and the child quality measure reporting, can we then have more than one person in each role?
This is Megan, and yes, you can have multiple people in each role for each system that you're applying to. Yes.
Okay, thank you.
And the same person can also fill multiple roles as well. We should clarify that. So you could have an individual in the state who is both the state editor and the state point of contact, and that's fine as well. Or those can be different people filled by multiple different people within your state.
Thank you.
And your next question comes from the line of. Your line is open. You did not say your name, but your line is open. If you have a question, you can.
Hello?
Hi, we can hear you.
Right. And your next question comes from the line of.
Maria Dover, North Carolina.
Please proceed.
Hi, I was wondering if you had anticipated dates for the follow-up trainings on, submission of the measures.
Hi, this is Laurel. Currently, we are looking at the beginning of December for the in-system demos.
Okay. Great, thank you.
Name not recorded.
You didn't record your name, but your line is open. If you have a question, you can proceed.
Hi, this is Karen Selle from CHIP and Health Analytics. Obviously, we're not a state and won't be submitting information or reporting, but we are working with our state customers in designing software so they can easily report. We're not interested in roles as much as we are actually seeing the reporting tool. So is it possible that we can have access to the next training session without filling out the user roles?
Jeanette and Megan, I'd like to defer this one to you. I know that we can send out the invitations. Are you open to having additional?
Yeah, I think generally our contact list is sent, and I think if you receive the communication, it's fine if that person invites you to participate in the demo session that's happening next month. I think that's not a problem without filling out the user roles template.
Very good, thank you.
And I'll go ahead and open all the lines for you. One moment.
Natasha, is the line open to everyone now?
Yes, the line is open to everyone now.
Okay, this is just a last call. No need to punch in numbers or anything. If anyone else has questions about the quality measure roles or the next steps, here's your chance.
And Bob, this is Megan. I actually think it might be helpful for folks to hear kind of what happens once they return the template back to the help desk. What do state users then do? What's the next steps there?
Okay, so once the role request template, completed role request templates are received at the MACPro help desk, we'll go through a process of auditing, ensuring the forms are completed properly, all the roles that are needed have been requested, and just a couple different audits. If there is anything that's flagged during those audits, we will escalate those to the business owners, to the regional offices, to work with everyone to get the information completed properly and on time. There is a timeliness to this. The completed templates will be forwarded on to the development contractor to create the IDs and passwords, and to set up the roles for those IDs. At the time, around the time when the system is going to be released, the email messages will be sent out with the IDs, a separate one with the passwords, for every individual who requested a role. I didn't say this in the earlier session, but if you do not get those messages, it may be a situation that something was wrong with the setup. Don't hesitate to contact the MACPro help desk. Again, if we could show that slide on the screen, it's MACPro help_helpdesk at cms.hhs.gov. That is where you can send it, but we don't expect the system to be live before the week of, maybe even around December 9th, maybe before that. But if you don't get those kind of communications, if you've submitted a role request and you don't get those communications before December 9th, definitely send a message to the help desk and we can help you out with that.
Hello, this is Lori Pena from New Mexico. I have a couple of questions, if I may.
Go ahead.
The first one is, New Mexico is a CHIP expansion, so we've always done our children and CHIP core measures on our carts. We have a tight deadline for carts, which is December 31st. Now we're hearing that these core measures are going to roll out approximately December 9th. So that that really puts a time crunch on us. Does that mean that we will have a separate deadline for the core measures? Will we still have the December 31st? Is it now an individual submission apart from carts?
So this is Megan. I can tackle that, Lori. The deadline for core set reporting has not been announced, but it will not at all be December 31st.
Okay.
That is a deadline for the CHIP annual report, but again, it's not the deadline for the core set measures. One of the things we want to make sure we're doing before we're setting deadlines for reporting is make sure that we have states in the system and operational before we say the report's going to be due on a certain date. We definitely want to make sure that states have enough time to familiarize themselves with the system before we set a deadline, but again, it's not going to be December 31st.
Thanks, and that's what I was worried about. So we can proceed with the CARTS template as we've received it now and go into the usual CARTS program. And then we'll receive a separate information later on regarding the core measures and the deadline for that. And that'll be, will they be different deadlines on a yearly basis? Like next year, are you planning to align it with CARTS, or will it continue to be a separate deadline?
I'm not sure we have that fully worked out yet. It also depends on the annual update for both systems. Both systems have to go an annual update process to ready them for the current reporting process. I think it's good that we can think about aligning them. We will, but it's something that we've just not determined yet. But to answer the first part of your question, yes, you should go ahead and proceed with your CARTS reporting because that deadline is fast approaching. And we'll announce the core set reporting deadline separately.
Thank you so much. That alleviates my concern. Appreciate it.
You're welcome.
This is Beverly Court from Washington State. Are you taking questions still?
Yes, go ahead.
I'm looking at your user template. So, for example, if I'm the state point of contact for the adult quality measure, there's no way to reconcile what your role is with which type of reporting. Is that correct? So this assumes that, for example, the state director oversees adult quality measure, child quality measures, maternal infant health quality measures, and health home quality measures. That's the way this template is laid out, unless what you're expecting is to have duplicate entries. So Jane Doe may be for adult quality measure reporting a state point of contact, but they may be a state director in terms of the health home quality measures.
I think I understand what you're saying, Beverly. I think your question is, let's say somebody is a state director for health homes, but they're a point of contact for adult core set. How do they enter that in the template?
Correct.
I will defer to the training team on this, but I would say enter, if you're in a situation like that where you have different roles in the different templates, I would enter the information twice. I would enter the user twice. I don't know if there's another way to rectify that in the current template.
That'll be a common, I think, it won't be uncommon in different states.
Right.
Since different people do different parts of this reporting.
Okay. Thank you.
This is Missouri. I have a question. It was my understanding that this tool is currently in use. Is that correct? Like for spas and and other things like that?
It is not currently in use. It will be getting released next month.
Okay. So I'm just trying to think how we do the administrator, but we'll figure that out in-house.
This is Beverly Court from Washington State, and just looking back on our experience with other reporting mechanisms, and this kind of user template as an example. So you'll be doing a lot of testing of those interfaces prior to releasing them? I know that there's been okay.
Sure, we've been undergoing quite a bit of testing over the past few months to make sure that they're ready for state reporting. So yes, we have been doing testing on these.
And then if there's an issue, then we reply back to MACPro, correct? If there's a problem, or is that going to the
MAC quality group? For example, if a numerator and denominator aren't transferring properly.
That's a good question, Beverly, and we'll reiterate, we have the slide up on the screen. So if you have, at any time, issues related to the MACPro system, so like you said, you can't enter the information into the system that you need to enter, contact the MACPro help desk, and that's MACPro_helpdesk at cms.hhs.gov, and there's also a phone number you can see on the screen. If you have issues related to the quality measure content, how do I construct my state level rate, for example? You would still reach out, probably as you do currently, to the technical assistance and analytic support contractor, and that's the Max Quality PA at cms.hhs.gov. And I would say, while this is the general guidance, we do have processes in place in the event that messages are going to the wrong mailbox. We're working on reconciling those messages and getting them to the right people for triage.
Could you send out this is Beth Court from Washington again, could you send out an example like I just quoted for your user template, where people are taking different roles for different types of reporting? Because it appears that you'd have to, I don't know if it's required that you fill out a no for the other ones, even though it'd be yes, but it's not relevant to that role selection. So if you could have an illustration of how one person is taking different roles for different quality reporting, that would be useful in completing this template.
Okay, I will ask that the training team, maybe Laurel, Bob, can circle back with Beth following the meeting.
Thanks.
Are there any additional questions? Okay, if we don't have any additional questions at this time, I think we can give you back 27 minutes of your day. Megan or Jeanette, would you like to say anything in closing?
I just want to say thank you so much for joining us today. I hope you found this to be a helpful session and look forward to introducing MACPro to you further in the future. Keep an eye out for the slides and recording of the session forthcoming. If you have any questions, please feel free to reach out to the MACPro help desk. Thank you for joining us.
Thank you.
Bye.
Ladies and gentlemen, that concludes today's conference. Thank you for your participation. You may now disconnect. Have a great day.
Thank you. Thank you.